Hello, my name is Dr. Alyssa Swick with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to offer ways to accommodate your clinic visits with individuals who need special assistance. In particular, I want to talk about wrapping up a visit in a way that maximizes your patient's understanding, as well as their agreement and adherence to the plan. It is important for patients to understand their diagnoses and our recommendations for monitoring, further evaluation, and management at home. It is valuable to summarize at the end of each visit in a way that involves a patient at their own level of health literacy. You may also need to work with both patient and caregiver to support the patient's needs optimally. Becoming fluent in the language of medicine requires years of training. Many of us fall victim to routinely speaking at a 12th grade literacy level or higher. Yet we know that we need to use more common language when speaking with patients. Most of our patients prefer to communicate at a 6th grade level. Patients with intellectual and developmental disabilities, or IDD, may better understand at a 3rd to 4th grade level. 8-word sentences and an average of 1.3 syllables per word is a way to approximate about a 4th grade level. People with IDD generally take longer to process information. You may need to speak more slowly and tolerate pauses between ideas. You may need to allow time for the person to respond, or invite a helper to restate your recommendations in a way they know the individual will understand. Because we are immersed in healthcare all day, we may take for granted that others know how to navigate their healthcare and the health system. In actuality, many patients find both these issues to be difficult. Consider each of these parts of your plan and how you can make the information more understandable. Present a new diagnosis with clarity, or explain when the diagnosis is not yet clear. Recommend specific follow-up timelines. Offer explicit verbal and written information about referrals for a specialist or procedure. Give explanations about prescriptions, including why, how, when, and what if. Provide supporting information about lifestyle modifications. Offer solutions to problems they might face when navigating these recommendations. For example, what do you do if the pharmacy can't fill the prescription? Or what do you do if the specialist never calls? Patients may appreciate handouts or references to websites or videos that provide additional information. Ask your patients how they learn best and what supporting information they would like. Consider sources of information that you trust with appropriate literacy level. You may find either of these two tools useful for patients and caregivers. The Aspire project at Portland State developed tools for persons with autism. The Office of Developmental Primary Care at UCSF also has valuable tools. The Aspire worksheet has more details to structure your recommendations for lifestyle modifications, medication management, additional evaluation and monitoring, referrals, and follow-up, clearly and concisely. The UCSF form is more abbreviated. As you are reviewing recommendations with patients, ask what they understand and whether they agree with your suggestions. If there is hesitation or resistance, consider accommodations that may be needed. Work to negotiate the best plan of care. For example, you may need to simplify lifestyle management or offer ways to make blood draws less painful. You may need to make smaller incremental changes and see the patient again to work on the next small step. Strive to understand from your patient and caregiver how best to approach a management plan. Finally, offer best ways to communicate with your office for any follow-up questions or needs. Many individuals will struggle to navigate our complicated system. If there is a way to offer a designated point person within your office, we encourage you to do so. We hope this video provides ideas for engaging patients to develop the best plan for their care at the end of a visit. Thank you for watching. To empower your patients to learn how to best participate actively in creating and understanding the plan for their care, you can refer them to our partner video at forourhealth.org.